Do you know when it comes to those nagging aches and pains that far too many of us feel much more often than we'd like to? It's been my experience that in many cases we are our own worst enemies. It's very often things we're doing unintentionally, repetitively at home or at work that's causing our tissues to be irritated and sore. It's kind of like clicking a mouse at an office job. It generally never hurts to click the mouse, but if you do it enough, you might even need carpal tunnel surgery for it. Hi, I'm Dr. Travis Howard, and today I'm going to share with you some information that I call repetitive strain injuries. I'm going to share a personal story of how I created left upper back pain on myself, and then give you a couple of examples of things that have actually worked for patients of mine. When I first got to the office in St. Johnsbury, I have an old desk and a laptop, and instead of putting the files on the laptop to read them, I would lean on my left shoulder to read the file. And it never hurt to do that. And I did it for probably a year, 4 days a week, 30 or 40 times a day. And I started getting a lot of left upper back pain. And I didn't know what was going on, and it was really hurting. And it took me much longer than it should have, because I actually teach this information to patients, that I was doing it to myself. One day, file in hand, I'm leaning on my elbow, and I'm totally doing this to myself. About that time, I was taking care of a police officer, and the next time I saw him, I shared that story, and sure enough, he's driving around all day like this, causing his right upper back pain. The trick is that it never hurt. Never once did it hurt for me to lean on that shoulder, so it didn't remind me or tell me that it might be irritating anything or causing the pain to begin with. And so I have seen so many times where a patient will have right hip pain on their chart, and I'll walk in and they'll be sitting like this, and I'll ask them how often do they sit like that, and they tell me all the time, because this can repetitively stress the muscles in the hip. It can be that favorite spot you have on the couch where you're always tilted one way and working on the laptop over here, or just this is my favorite spot on the couch and the husband's over there, and this can stress certain different tissues in your body. I've seen many times where back when flat screen TVs became a lot less expensive, the old big boxy TVs there, the new flat screen TVs on the wall over there, and you didn't change your furniture around, and that could create neck pain for patients. I had a patient one time with the right shoulder discomfort that as soon as I shared the story with, the very next visit they came in and she said, I just take my laptop and briefcase and put it in the passenger seat and drive to work and retrieve it. And simply by stopping doing that activity, her shoulder pain went away. I never lean on this left shoulder to do my notes anymore except to share this story. When I share this story with patients at my office, a lot of times someone will have a light bulb go off in their head, and so often that's the thing. So if you had any light bulbs go off of, my hip is sore and I do sit like that all the time, or my shoulder's sore and I do drive in my car like this, there's probably a good chance that might be contributing to, if not causing, the symptoms that you're feeling. I'll give you a couple more examples. Very often, repetitively sitting or bending and twisting opposite will cause hip pain. I had a patient who had to bend down and put things into her filing cabinets over and over and over again throughout the day, and she's getting a lot of right hip pain, and we discussed this concept, and what she changed is she just allowed that stuff to pile up and did it at the end of the day sitting right in front of the file, and her symptoms, again, they got much better. I hope that somebody found this information helpful. I share this information with every patient, and it's not in every case, but there are so many cases where the things we're doing unintentionally, repetitively at home or at work can contribute or cause what we're feeling. If you found this helpful at all, please hit that like and share button, and as always, have a great day.